Hi, this is Dr. Brad from Life Chiropractic Center here in Burlington, Ontario. And last week we talked about how most fevers are good for your children. And now I know that for many of you that this bit of information really rocked your world. So today I'm going to teach you how you can differentiate between a good, healthy fever and a potentially dangerous fever. Because in my opinion, every responsible parent must know how to do this. Now, the first thing you need to know is what is normal body temperature. If you are measuring in degrees Celsius, it is 36 to 36.8 degrees Celsius. If you are measuring in Fahrenheit degrees, it is 97.7 to 99.1 degrees Fahrenheit. So, any temperature above 36.8 degrees Celsius or 99.1 degrees Fahrenheit would constitute a fever. Now, the easiest way for a parent to take their child's temperature is either orally under the tongue with the traditional thermometer, or you can use a specialized ear thermometer and take the temperature directly in the ear canal. What you need to remember, however, is that temperature oftentimes fluctuates, especially in small children. So for this reason, you may need to take their temperature a few times before you can determine if they have a fever or not. Now, here is the most important information in today's segment. These are the signs and symptoms that you must be aware of in order to be able to differentiate between a safe, healthy fever and a potentially dangerous fever. And they are a fever of 38 degrees Celsius or more for 3 days in a row. And if you're measuring in Fahrenheit degrees, it would be a fever of 101 degrees Fahrenheit or more for 3 days in a row. Any unusual behavior in your child, such as continuous crying, screaming, unusual drowsiness, seizures, hallucinations, pain and stiffness in the neck, shortness of breath, persistent diarrhea, or a rash of any kind, any place on their body. If you notice any of these signs or symptoms in your child, you need to get them to the family doctor or to an emergency room as soon as possible, because medical intervention is most likely required, and especially if your child has just received a vaccination. Now, if none of these signs or symptoms are present, your child is having a safe, a healthy fever, and there is no concern on your part as a parent, but it's always a good idea to keep an eye out for the danger signs until the fever has completely gone. Now, in next week's segment, we will talk about what you can do to make your child feel more comfortable when they are having a good, healthy fever. But in the meantime, if you would like more information on this topic, or you have any other questions or concerns about your child's health, give us a call at 905-335-5433. Please remember, consultations are always free, and that we are here to help families just like yours build vibrant, healthy, drug-free lives. And I look forward to speaking with you next week.